I think one of the great things about being at a place like Washington University is that the clinical experience helps to direct our research, and the research helps to direct our clinical focus as well. And so I'm fortunate to be in a department and with partners who both share this same clinical and research interest. So we have a lab that looks at translational techniques to help identify ways to help nerves regenerate and to repair, and then also helps identify ways to better evaluate nerves in surgery. So are there ways that we can image nerves intraoperatively to help get an idea of how injured they are, which will help us direct how to best treat them in surgery. So I work with a team of people to do that, and myself and Dr. D have a lab that looks at both the basic science and translational parts of the research in terms of nerve repair and regeneration, but we also look at some of the public health and epidemiologic aspects of it as well. We feel that we need to understand the problem of nerve injuries on a more global basis to help us to identify what the best way is to treat these patients, and then also to look into the lab and identify new treatment mechanisms that may work for them.